Hello and welcome to Evergreen Health. I'm Dr. Margaret Evans, a cardiovascular health researcher with over 35 years of clinical and academic experience. And today, I'm going to ask you something bold, something urgent. What if the vegetables you trust the most are quietly harming your heart? Yes, I said vegetables. I know how strange that sounds. For decades, we've told ourselves, and each other, that eating more greens is always the answer. After all, they're natural, they're healthy, they've been around since ancient times. But what if I told you that this belief, when misapplied after age 60, could do more harm than good? What if your morning spinach smoothie is clashing with your heart medication? What if your favorite pickled snack is secretly pushing your blood pressure higher every day? Or worse, what if that raw garlic clove, that innocent sprout, or that pinch of red chili is interfering with your heart's most delicate rhythm? You see, aging changes everything. Your digestion slows down. Your medication needs increase. Your liver filters differently. Your blood vessels lose flexibility. And most of all, your tolerance to food interactions becomes fragile. Let me tell you a story. Harold's fall. Harold was 72, retired, proud of his healthy lifestyle. He had never smoked, stayed active, and loved to cook. Inspired by health blogs and YouTube wellness videos, he added raw garlic and spinach to his meals every day. One afternoon, Harold collapsed while gardening. He didn't feel dizzy. He wasn't in pain, but his blood pressure dropped so suddenly that he lost consciousness. At the hospital, we discovered the issue. He was taking warfarin, a blood thinner, and had unknowingly overloaded his body with vitamin K from spinach and thinned his blood too much with raw garlic, a combination that created the perfect storm for internal bleeding. Harold survived, but not without serious damage to his heart valves due to delayed treatment. And here's the hardest part. He thought he was doing everything right. Why this matters: many seniors fall into the same trap, trusting natural food while forgetting that even nature has limits. After 60, your body isn't just reacting to food. It's reacting to food, plus medication, plus aging vessels, plus slower immunity. And that's exactly why today's video is so important. I'll walk you through 5 vegetables that may be healthy in theory, but dangerous in reality for seniors with heart concerns. I'll show you how to spot the risks, how to adjust preparation methods, and which alternatives are safer. But I'll go further than that. I'll share real stories, like Harold's, of patients I've cared for, who turned their health around not with strict diets or expensive treatments, but with awareness and small, consistent changes. Because you deserve better than fear. Better. You deserve clarity. So grab a cup of tea, take a deep breath, and stay with me until the end, because your heart deserves this attention. Part 1. Spinach, the green, that overpowers your medicine. Let's revisit the story of Dolores, a vibrant and independent 68-year-old widow from North Carolina. After her husband passed away, Dolores made a quiet vow. I'm going to stay healthy so I can be here for my granddaughter's graduation. She took that promise seriously. She joined a gentle yoga class for seniors. She walked every morning. She even started growing her own vegetables in the backyard, including a small, thriving bed of spinach. Every day, Dolores made what she called her Superwoman smoothie. It had bananas, Greek yogurt, almond milk, chia seeds, and 2 big handfuls of fresh spinach. She'd read online that spinach was great for heart health and blood pressure, and like many of us, she believed what she saw. Spinach is a superfood, right? But what she didn't know was that the very food she was growing with love was quietly putting her in danger. Dolores was taking warfarin, a blood thinner, after having a minor stroke 2 years earlier. Her doctor had carefully adjusted her medication based on regular INR tests, a blood test that measures how long it takes to clot. Everything had been stable, until it wasn't. Dolores started feeling unusually tired. Her gums bled when she brushed her teeth. Bruises showed up on her legs without explanation. One spring morning, she fainted while tending to her garden. At the hospital, tests revealed that she was experiencing internal bleeding. Her INR was way too high. The reason? Spinach. Spinach. Healthy. But not for everyone. Let's be clear. Spinach is full of good stuff. Vitamin A for eyesight, iron for blood health, magnesium for muscle function, and most importantly, in this case, vitamin K1. Now, vitamin K1 plays a big role in helping your blood clot. That's usually a good thing. But when you're taking blood thinners like warfarin, it becomes a delicate balancing act. Warfarin works by limiting how your body uses vitamin K. It thins your blood to help prevent strokes, heart attacks, or dangerous clots. But if you suddenly eat a lot of spinach, or if you eat it inconsistently, you throw off that balance. Too much spinach. Too much vitamin K. Warfarin doesn't work properly. Blood too thick. Suddenly. Stop eating spinach. Not enough vitamin K. Warfarin works too well. Blood too thin. And the worst part, you won't feel it happening. There are no warning bells, no early symptoms. By the time you know something's wrong, it might already be too late. Why seniors are at higher risk. Now you might be thinking, but I've eaten spinach my whole life. That's fair, but our bodies change as we get older. Your liver doesn't process nutrients or meds as efficiently. Your kidneys slow down. You may be taking multiple prescriptions, which interact in complex ways. Your gut absorbs nutrients differently than it did when you were 30 or 40. So what worked for you before may not work now. And even if spinach was once a health booster for you, your medication now changes that equation. Let's break it down. Simply. Here's how spinach and warfarin interact. Spinach has a lot of vitamin K1, which helps your blood clot. Warfarin blocks vitamin K from being used, which thins your blood. If you eat a big amount of spinach, the warfarin can't keep up. Your blood gets too thick. If you suddenly stop eating spinach, the warfarin works too well. Your blood gets too thin. This creates a dangerous seesaw effect in your bloodstream. And the truth is, it's happening silently in thousands of seniors every day. George's story, when healthy habits go wrong. Let me introduce you to George, a retired firefighter. He's 76 and was recovering well after a heart attack a few years back. He was on warfarin, following his doctor's orders, and feeling pretty good. Then a neighbor introduced him to green smoothies. George thought, great, even more heart-healthy stuff. He started drinking them every morning, rotating between spinach, kale, and Swiss chard depending on what he had in the fridge. At his next checkup, his INR was dangerously low. A few days later, he had a TIA, a small stroke. When the doctors reviewed his diet, the cause was obvious. Too much vitamin K in random, inconsistent amounts. His blood had gotten too thick. George sat across from me and said, "But I thought I was doing everything right." He was. He was trying. But trying doesn't replace understanding. Let's talk about you for a moment. Can I ask you a few things? Do you drink green smoothies, even just a few times a week? Do you alternate between leafy greens, depending on what's fresh or on sale? Are you on blood thinners like warfarin, clopidogrel, Plavix, or aspirin? If you said yes to any of those, your food choices might be quietly affecting your medication and your heart. This isn't about blaming yourself. It's about empowering yourself, because when you understand the interaction, you can take back control. What you can do right now. If you're over 60 and taking blood thinners, here's what I recommend. 1. Be consistent with greens. Eat similar amounts of spinach or other greens each week, not big swings up and down. That makes it easier for your doctor to manage your medication. 2. Cook it. Instead of eating it raw. Cooking spinach reduces its vitamin K content by up to 60%. Lightly steaming or sautéing is safer and easier on digestion. 3. Talk to your doctor. Yes, about food. Bring a short food journal to your appointment and ask, do any of these foods interfere with my prescriptions? 4. Don't rely on superfood. Hype. Just because something is natural doesn't mean it's automatically good for everyone. Your heart has specific needs now. 5. Watch for warning signs. Keep an eye out for easy bruising, bleeding gums, fatigue or weakness, blood in stool or black stools. Any of these could mean your blood is too thin or thick. Safer vegetable options. Want to stay heart healthy without the spinach risk? Try these. Steamed kale, in consistent amounts. Zucchini, low in vitamin K. Roasted carrots, cooked broccoli or cauliflower. Sweet potatoes, great for potassium and blood pressure. Final thoughts. A lot of seniors feel guilty when told to stop eating something healthy. They say things like, I thought I was doing good. I'm trying my best. I just want to live longer. Let me tell you something. You are doing your best. This isn't about blame. This is about adjusting to what your body needs now. Aging isn't weakness. It's wisdom. It's about recognizing that your body is changing and responding to that with love, patience, and smart choices. A doctor's note to you. As someone who's spent over 30 years working with seniors, I've seen how small things make huge differences. A teaspoon less salt. A vegetable switch. A better question asked during a checkup. Spinach isn't your enemy, but random, unpredictable spinach intake while on blood thinners. That's a risk you don't need to take. Let's stop letting healthy become harmful. Let's start living with clarity and confidence. Part 2. Pickled cucumbers. The salty side dish. That's silently raising your blood pressure. Let's go back to the story of Eleanor, a 74-year-old grandmother from Michigan who had worked hard to get her health back on track. In her early 60s, she was diagnosed with high blood pressure. Like many seniors, she made some serious lifestyle changes. She quit smoking, started walking daily, gave up fried foods, and began cooking at home with healthier ingredients. Eleanor felt proud. She'd done everything right. And yet, despite all her efforts, her blood pressure stayed high. Her doctor added another medication, then a third. Still, no real improvement. Eleanor couldn't understand what was going wrong. That is, until she sat down with a dietitian. I don't eat out, she said. I cook fresh meals, and the only thing I really keep around is pickles. I like a few slices with my sandwich at lunch. It's just a little something crunchy. That little something turned out to be a big deal. Those pickle slices, sharp, tangy, and seemingly harmless, were packed with more sodium than her entire entree. And they were silently sabotaging her blood pressure. The sodium shock in pickles, or pickled cucumbers, are made by soaking cucumbers in a salty brine. That brine often contains salt, vinegar, spices, and sometimes sugar. The result? A tangy, crunchy treat with a secret: high sodium content. Let's break it down. Just one medium-sized pickle spear contains 400 to 700 milligrams of sodium. A few slices with lunch? That's easily 1,000 milligrams or more. That's 2/3 of the daily sodium limit for older adults from just one side item. Now, let's compare. A small order of fries at a fast food place often has less sodium than a serving of pickles. And that's what makes them dangerous. Pickles feel healthy. They're veggies, right? They're not deep fried. They're not processed junk. But that perception is misleading and risky. Why sodium is so hard on the aging heart. After decades of treating seniors with high blood pressure and heart failure, I can tell you this: sodium is one of the most underestimated threats to your heart. Here's why. 1. It increases blood volume. Sodium pulls water into your bloodstream. That extra fluid increases the pressure inside your arteries, making your heart work harder with every beat. This can cause swollen ankles or feet, puffy hands or face, a tight or bloated feeling after meals. 2. It raises blood pressure. More fluid means more pressure. And over time, that pressure leads to hypertension, thickened heart walls, heart failure. 3. It damages your blood vessels. High sodium levels over time stiffen your arteries and cause inflammation, raising the risk of strokes, aneurysms, kidney disease. A real example: Albert's pickle habit. Albert, a 79-year-old retired schoolteacher, had done a great job managing his heart failure. He ate a heart-healthy diet, exercised regularly, and took his medications every day. Then something changed. He started having trouble breathing while walking. His legs began to swell. He felt heavy, tired, and foggy. The reason? He had developed a habit of eating 2 to 3 large homemade garlic pickles with lunch and dinner, every single day. Even though they were homemade, those pickles were packed with salt, and his heart couldn't handle the sodium load. His medications couldn't keep up. He was admitted to the hospital with fluid in his lungs, pulmonary edema, brought on by hypertensive crisis. He pulled through, but it took IV medication, diuretics, and days in the ICU. And all along, he thought he was doing fine. That's the heartbreaking part. Why sodium affects seniors more severely. Here's what changes in your body after 60. Kidney function slows down. Your kidneys aren't as efficient at flushing out excess sodium, so it builds up faster. Hormone levels. Change your body makes less aldosterone, a hormone that regulates salt and fluid. This makes you more sensitive to salt. Arteries get stiffer. As we age, blood vessels naturally lose elasticity. That makes them more reactive to changes in blood volume, so even a little extra sodium can cause a big spike in blood pressure. Medications can interact. Many seniors take diuretics, beta blockers, or AC inhibitors. But if your sodium intake is high or inconsistent, these drugs may not work as well as they should, or may even become harmful. Other foods. High in sodium that don't taste salty. Pickles may be the obvious culprit, but sodium hides in many foods we think are healthy. Check your kitchen for canned vegetables, jarred tomato or pasta sauces, low fat or healthy soups, frozen meals, salad dressings, store-bought bread or sandwich rolls. You may not sprinkle salt at the table, but these products could already push you over your limit. How much sodium is safe? If you're over 60 or living with heart disease or kidney problems, the American Heart Association recommends no more than 1,500 milligrams of sodium per day. That's just over half a teaspoon of salt for the entire day. The average American consumes twice that, often without even knowing it. 5. Simple ways to cut sodium without losing flavor. Let's be real. Food should still taste good. Here's how to protect your heart without sacrificing flavor. 1. Read every label. Look for low sodium, under 140 micrograms per serving. No salt added. Best option. Watch out for reduced sodium. That just means it has less than the regular version, not that it's low. 2. Choose fresh or frozen over. Canned fresh or frozen vegetables have 0 sodium. If you must use canned, rinse them thoroughly under cold water to remove up to 40% of the sodium. 3. Flavor with herbs, not salt. Try garlic powder, not garlic salt, lemon juice, fresh or dried herbs, rosemary, thyme, oregano, dill, turmeric, or smoked paprika. These add taste without adding pressure on your heart. 4. Make your own pickles without the salt. You can make delicious pickles with vinegar, lemon juice, fresh dill, and garlic. No added salt. It takes a little creativity, but your heart will thank you. 5. Track what you eat. Keep a food diary or use an app like MyFitnessPal to see how much sodium you're actually getting each day. Healthy swaps for crunch and flavor. You can still enjoy flavor and texture. Just make a smarter swap. Instead of, try this: pickled cucumbers, fresh cucumber slices with vinegar, plus dill salty olives, roasted cherry tomatoes with garlic and herbs, canned soup, homemade vegetable broth with fresh ingredients, crackers or pretzels, unsalted rice cakes or roasted chickpeas. A message to you. From one human heart to another. You've lived long enough to know that life is full of small joys. Maybe pickles were one of yours, a childhood memory, a Sunday lunch favorite, a comfort food when things felt off. That's okay. That's human. But now, your body is asking for something different. Let me ask you, have you been struggling with high blood pressure that won't go down, even with medication? Have you noticed swelling in your feet or ankles lately? Are you feeling tired and heavy after meals you used to enjoy? If any of that sounds familiar, sodium might be the hidden culprit. But here's the good news. You have the power to fix it. Not with drastic diets, not with punishment, but with small, consistent choices, starting with a jar in your fridge. Part 3. Red chili peppers. When flavor becomes a cardiac trigger. Let me tell you about Ricardo, a 70-year-old retired chef from San Antonio, Texas. He loved life. He loved food even more. And when it came to flavor, spice was everything. In Ricardo's kitchen, chili peppers weren't just seasoning. They were tradition. He used habaneros, serranos, and crushed red pepper in just about every dish. Spice keeps the blood flowing, he used to say. But one night, after eating a particularly spicy dinner, Ricardo collapsed while watching TV. His heart was pounding. His blood pressure had jumped to 195/100. His daughter called 911, and he was rushed to the hospital. He didn't have a heart attack, but he did experience a hypertensive crisis, a sudden and dangerous rise in blood pressure. And it was triggered by capsaicin, the active chemical found in chili peppers. What happens to your body when you eat chili peppers? Capsaicin tricks your body into thinking it's under attack. It sends a message to your brain that says, "Emergency." Your body responds by activating the fight or flight system. Adrenaline is released. Your heart rate goes up. Blood vessels tighten. Blood pressure spikes. For younger people, this kind of stimulation might be fine. But for adults over 60, especially those with high blood pressure or heart disease, it can be dangerous. Why chili is riskier. As you get older. As we age, our hearts and blood vessels go through natural changes. Here's how. Arteries become less flexible. Blood pressure becomes harder to control. The heart becomes more sensitive to stress. Add spicy food to the mix, and it's like throwing gasoline on a small fire. Let me ask you, do you ever get heart palpitations after eating something spicy? Do you feel flushed or sweaty after a peppery meal? Are you taking blood pressure meds or blood thinners? If you answered yes to any of these, it may be time to reconsider how much spice your body can handle. A real example, Lucia's story. Lucia Garcia, 68, came to my clinic with complaints of a racing heart and shortness of breath. Her test results were all normal, but something didn't add up. I asked her, "Do you eat spicy food?" She smiled. "I'm Mexican. Of course I do." Turns out, she was adding chili flakes to every meal, even her breakfast eggs. What she didn't realize was that her daily spice habit was triggering episodes of tachycardia, a fast and irregular heartbeat. After cutting back on the heat and making a few simple changes to her diet, the symptoms went away. She didn't stop eating flavorful food. She just learned to use different ingredients. The truth about spice and metabolism. Yes, capsaicin can slightly boost metabolism, but that doesn't make it good for everyone, especially not for seniors. Research shows that spicy foods can increase oxidative stress in the body, cause inflammation in the digestive system, interfere with how your body absorbs certain medications, prolong irregular heart rhythms in those with atrial fibrillation. So while chili might have benefits for some, for older adults, especially those with heart issues, the risks often outweigh the rewards. Why you may not notice the damage right away. The tricky part is, your body can get used to the heat. You build tolerance over time, so the burning sensation goes away. But the stress on your heart doesn't. That's the danger. Your heart keeps working harder behind the scenes. Your blood vessels get irritated. Inflammation builds. You don't feel it until something goes wrong, like Ricardo's collapse. It's like a small leak in your roof. You don't see the damage until there's a storm. Flavor without the fire. You don't have to give up tasty food to protect your heart. Here are some flavorful, heart-friendly alternatives. Lemon or lime zest. Adds brightness without spice. Fresh herbs like rosemary, thyme, or basil. Add aroma and depth. Cooked garlic. Adds richness without irritating your system. Roasted vegetables. Natural sweetness and flavor without heat. Caramelized onions. Mild and savory. Great in soups or stews. These swaps don't just protect your heart. They also keep your meals exciting and satisfying. Be careful with hot sauce. Some people give up chili peppers, but keep using hot sauce. Bad idea. Most hot sauces are high in sodium, full of preservatives and vinegar, known to irritate the stomach lining. A teaspoon of hot sauce can have 200 to 400 milligrams of sodium, and that adds up fast. It can trigger acid reflux, heart palpitations, poor sleep due to nighttime blood pressure spikes. So even if the heat feels milder, the impact on your body can be just as harsh. When is some spice okay? If you're under 60, not on heart medications, and don't have high blood pressure or arrhythmias, then a little mild spice here and there might be okay. But if you are over 60, take beta blockers, ACE inhibitors, or blood thinners, have had a stroke, or live with hypertension, it's better to avoid chili peppers or use them under medical supervision. What the research shows. Large studies show that moderate chili intake might help in younger, healthy people. But in seniors, especially those with heart risks, heavy chili consumption is linked to higher rates of cardiovascular death. It's a U-shaped curve. A little dachos might help. A lot, detour can hurt. especially as you age. Ricardo's comeback. After Ricardo's emergency room scare, he made some important changes. He didn't give up flavor. He simply made smarter choices. He replaced chili with cumin and smoked paprika, swapped jalapenos for roasted red bell peppers, drank chamomile tea at night instead of spicy broth. Within a few months, his blood pressure stabilized. His irregular heartbeat stopped. His doctor lowered one of his medications. "I still love food," Ricardo told me, "but now I cook with my heart in mind, not just my taste buds." Let's reflect. Spicy food can feel comforting. For many of us, it's connected to culture, family, and warm memories. But your body isn't what it used to be. You don't have to give up the meals you love. You just have to modify them for the heart you have now. So let me ask you, have you noticed any heart symptoms after eating spicy food? Are you using more chili or hot sauce now than you did a few years ago? Are you willing to try new flavors that won't push your blood pressure into dangerous territory? If the answer is yes, then you're already on the right track. Part 4. Raw garlic. When nature's medicine turns against your heart garlic. For many of us, that word brings comfort. The smell of it sizzling in a pan, the taste in a favorite recipe, or memories of a parent saying, "It's good for the heart." And it is, in the right way. But here's what most people don't realize. When garlic is raw, and especially when it's combined with certain heart medications, it can quietly turn from helpful to harmful. Let's take the case of Ruth, a 76-year-old from Colorado. Ruth believed in natural healing. She read blogs, watched wellness videos, and swore by garlic. Every morning, she took 2 raw garlic cloves, whole, like pills, with a glass of water. But then she started feeling dizzy. She bruised easily. She had random nosebleeds and felt exhausted all the time. One morning, Ruth collapsed in her kitchen. At the hospital, doctors found she had internal bleeding, not from trauma or illness, but from a dangerous reaction between garlic and her heart medications. Why garlic gets so much praise? Let's be fair, garlic has earned its reputation. It contains allicin, a compound released when garlic is chopped or crushed. Allicin has been shown to lower LDL, bad cholesterol, help regulate blood pressure, fight off bacteria and viruses, improve blood flow and circulation. Garlic is one of the most studied natural remedies in cardiovascular science. It's been used for centuries, and rightly so. But what matters is how much, what form, and whether you're on medication. When garlic and medications don't mix, raw garlic has blood-thinning effects. That might sound good for heart health, but if you're also taking medications that thin your blood, like warfarin, Coumadin, aspirin, Plavix, clopidogrel, heparin, NSAIDs like ibuprofen or naproxen, then combining raw garlic with these drugs can increase your risk of dangerous internal bleeding, nosebleeds that won't stop, bleeding gums, unexplained bruising, very low blood pressure, hemorrhagic stroke. That's what happened to Ruth. Her garlic intensified the effects of her medication, pushing her blood's clotting ability to dangerously low levels. What garlic does inside the body. Here's a breakdown of what happens. It prevents platelets from sticking together. This helps prevent clots, but too much, and your blood won't clot when it needs to. It amplifies your medication's blood-thinning effect. Garlic can double or triple the effects of prescribed blood thinners. It lowers blood pressure. Good in moderation, but when combined with heart meds, your pressure might drop too low, causing fainting or falls. It slows drug metabolism in the liver. That means medications stay in your system longer, making them stronger than intended. Another real case. Mr. Anthony's collapse. Anthony, 80, was a retired electrician who loved gardening and believed in clean living. Every afternoon, he crushed a raw garlic clove and added it to his tea. One day, after standing up from a garden bench, he passed out cold. His blood pressure had dropped to 78/50, dangerously low. The culprit? A combination of his blood pressure medication and too much raw garlic. His kidneys couldn't process both fast enough. He spent 2 days in the hospital on IV fluids. Anthony didn't mean to harm himself. He thought he was helping his heart. But the truth is, natural remedies still have powerful effects, and they need to be used carefully. Signs that garlic might be hurting you. If you're over 60 and using garlic, especially raw, while taking heart or blood pressure medication, look out for frequent bruises on arms or legs, bleeding gums when brushing your teeth, nosebleeds that last longer than usual, feeling faint or dizzy when standing, fatigue or cold hands and feet, dark or black-colored stools, lower than usual blood pressure readings. If any of these sound familiar, talk to your doctor. It could be the garlic. Raw versus cooked garlic. Big difference: raw garlic. Cooked garlic. High allicin content, lower allicin content. Strong blood-thinning, milder effects, can irritate stomachs, easier to digest, not safe with some meds. Safer for most seniors. Cooking garlic. Even lightly sautéing or roasting it greatly reduces its potency while keeping its delicious flavor. That's a smarter choice for seniors. How to use garlic safely as a senior. You don't have to give up garlic, but you do need to be smart about it. Don't swallow raw cloves whole. It's hard on your stomach and unpredictable in your bloodstream. Use cooked garlic in food instead. Sautéed in olive oil, roasted in the oven, or added to soups and sauces. Avoid garlic supplements unless your doctor approves. Many pills are concentrated, up to 20 times stronger than a clove. Talk to your doctor. Always mention garlic if you're starting or adjusting medications. Don't double up. If you have a garlic-heavy meal, avoid taking your heart meds at the same time. Are garlic supplements safe? In short, not always. Garlic pills are not regulated by the FDA, and dosages can vary wildly. Some contain the equivalent of 10 to 20 raw cloves in one capsule. Even one pill a day has been shown to increase bleeding time, especially in people over 60. Unless your healthcare provider specifically recommends them, avoid garlic supplements. Ruth's new garlic routine. After her health scare, Ruth made simple changes. She stopped swallowing raw garlic. She now roasts a bulb of garlic each week and spreads it on toast or adds it to meals. She enjoys garlic in 3-4 cooked dishes per week, not daily. Most importantly, she now communicates with her doctor about her diet. "I still love garlic," she told me, "but now I love myself enough to eat it safely." Final thought. Let me ask, do you assume natural remedies are always safe? Are you using garlic daily without discussing it with your doctor? Have you ever thought, more is better? At 60, 70, or 80, your body isn't the same as it was decades ago. That doesn't make you weak. It makes you wiser and better equipped to take control of your health with the right information. Garlic is powerful, but power without caution becomes risk. So if you love garlic, that's great. Just cook it, use it moderately, and never mix it blindly with heart medications. Part 5. Raw sprouts. The innocent crunch that could break a senior's heart. They look innocent, fresh, light, and green. Raw sprouts like alfalfa, mung bean, radish, and clover are often seen as health food staples. They're added to salads, wrapped in sandwiches, and blended into smoothies with promises of detox, longevity, and natural vitality. But for seniors, these tiny greens can quietly become a serious health hazard. Let me tell you about Clara, a 69-year-old yoga instructor from Oregon. She avoided red meat, walked daily, and believed a raw diet was the key to staying young. Every week, she sprouted her own mung beans on the kitchen counter and tossed them into meals. One morning after eating her usual sprout-filled salad, Clara felt dizzy and nauseous. A few hours later, she was vomiting, shaking with fever, and struggling to stay conscious. She was rushed to the ICU. Blood tests confirmed an E. coli infection, traced directly to her raw sprouts. But it got worse. The bacteria had spread to her heart's inner lining, causing endocarditis, a life-threatening condition. Clara survived, but only after weeks of antibiotics and round-the-clock monitoring. It wasn't fried food that almost ended her life. It was a raw, health food she'd trusted for years. Why raw sprouts are dangerous sprouts grow in warm, humid, enclosed environments, the same conditions that bacteria love. Even if they look clean and smell fresh, sprouts can be contaminated from the inside out. Washing won't help because the bacteria often live inside the sprout tissue. Sprouts commonly carry E. coli, Salmonella, Listeria monocytogenes. All three have been linked to serious outbreaks, especially among older adults. Why seniors are more vulnerable. For younger adults, contaminated sprouts might cause a day or two of stomach discomfort, but for people over 60, the risk is much greater. Here's why. 1. Weakened immune function. Aging naturally reduces your immune response, making it harder to fight off infections quickly. 2. Pre-existing health conditions. Conditions like heart disease, diabetes, or kidney disease make the body more fragile when dealing with infections. 3. Slower digestion and gut changes. The gut lining becomes thinner and slower with age, making it easier for bacteria to pass into the bloodstream. 4. Medication side effects. If you take proton pump inhibitors, PPIs, like omeprazole for heartburn, your stomach produces less acid, giving harmful bacteria a better chance to survive and cause illness. Let me ask, are you over 65 and taking medication for reflux or indigestion? Do you use raw sprouts in meals without cooking them? Have you experienced fatigue, dizziness, or stomach trouble after eating clean food? If yes, raw sprouts may be riskier than you think. Real case: Frank's raw sprout scare. Frank, 81, was a retired schoolteacher from Ohio. He lived independently, managed his type 2 diabetes, and liked to cook his own meals. One day, he saw a health segment on TV that praised the benefits of alfalfa sprouts. Inspired, he started adding a small handful to his lunch sandwich each day. A week later, Frank felt unusually tired. He had a mild fever and some chest discomfort. He thought it was just a cold. But 2 days later, he collapsed in his living room. The diagnosis? Bacterial endocarditis, caused by salmonella from raw sprouts. The infection had damaged one of his heart valves. He spent 3 weeks in the hospital, and although he recovered, he was never quite the same. The data doesn't lie. The Centers for Disease Control and Prevention, CDC, has tracked multiple outbreaks tied to raw sprouts. 1996, over 100 people infected with E. coli from alfalfa sprouts. 2009, 235 salmonella cases across 14 states. 2014, Listeria outbreak. Affecting seniors tied to clover sprouts. Because of these repeated outbreaks, raw sprouts are now on the FDA's high-risk food list for adults over 65, pregnant women, anyone with a weakened immune system. Warning signs to watch for. If you're over 60 and have recently eaten raw sprouts, pay attention to symptoms like nausea or vomiting, fever or chills, fast heart rate, chest pain or tightness, fatigue or confusion, Black or bloody stool, low blood pressure. These may be signs of a systemic infection. And if you have heart disease, the risk of sepsis or endocarditis is much higher. The myth: raw is always better. We've all heard it. Raw food is healthier. Cooking kills nutrients. That's only partly true. Yes, raw food preserves some enzymes and vitamins, but it also keeps more bacteria. When you're young and your immune system is strong, you can fight it off. But after 60? Your body isn't built to handle that risk anymore. Cooking food doesn't mean less healthy. It means safer. Let me ask, are you still following a raw diet plan you started in your 40s? Are you avoiding cooking because it feels less natural? Would you be open to changing your habits if it meant protecting your heart? How to eat sprouts safely. You don't have to give up sprouts entirely. Just change how you prepare them. Here's how. 1. Always cook sprouts. Steam, stir-fry, or sauté them for at least 1 to 2 minutes. This kills most harmful bacteria. 2. Avoid raw sprouts in restaurants. Even organic or fresh sprouts can be risky, and you can't verify how they were handled. 3. Skip homegrown sprouts. Unless you're trained. At-home systems can be hard to sanitize. If you're not using strict sterilization, don't take the chance. 4. Use cooked sprouts as toppings add to soups, stews, stir-fry, omelets. They'll still be nutritious and flavorful, but much safer. 5. Tell your doctor if you've felt sick. After eating sprouts, don't wait. The earlier you catch an infection, the easier it is to treat. Safer substitutes for that crunch. Craving that crisp green texture in your meals? Try these instead of try this. Raw alfalfa sprouts, steamed broccoli sprouts, raw mung bean sprouts, stir-fried mung sprouts with garlic and ginger, raw sprout salads, shredded cabbage with lemon juice, crunchy toppings, roasted chickpeas, or sunflower seeds. These swaps deliver crunch, fiber, and flavor, without the risk of infection. Clara's new approach. After her close call, Clara didn't ditch her healthy lifestyle, but she did make adjustments. She now steams all her sprouts before eating them, avoids raw food at restaurants, focuses on warm, cooked, gut-friendly meals, talks with her doctor before trying new health trends. "I thought eating raw meant being healthy," she told me. "Now I know. Being safe is part of being smart." What you should remember. Sprouts may look clean, but they can carry deadly bacteria. Seniors are especially vulnerable to foodborne illness. Raw doesn't always mean better. Cooking is not a step backward. It's a step toward living longer, stronger, and safer. Let me ask you one last time. Are you eating for your current age, or for the body you had 20 years ago? Are you willing to adjust your habits to feel better and stay out of the hospital? If the answer is yes, then you've already taken the most important step toward protecting your heart. Part 6. Healing Foods 2. Embrace after 60. What should seniors eat instead? So far, we've talked about what not to eat. The 5 vegetables that, despite their healthy image, can undermine your heart if you're over 60. But what about the other side of the story? What should you eat? What foods truly support the aging heart, nourishing your arteries, reducing inflammation, and harmonizing with your medication instead of fighting it? Let me begin with a truth I've learned after 4 decades of practice. Healing doesn't begin with medicine. It begins with the plate. Let me share with you the story of Dennis, a 77-year-old former truck driver from rural Ohio. Years of poor dietary habits had taken their toll. High cholesterol, heart failure, kidney issues. He had tried medication after medication, but his energy was low, his blood pressure was erratic, and his weight was climbing. Then one visit changed everything. Rather than add another pill, we created a food-first strategy focused on heart-loving vegetables. Within 3 months, Dennis lost 12 pounds, stabilized his blood pressure, and even reversed his early-stage kidney dysfunction, all without a single new prescription. What should seniors eat to heal and protect the heart? After 60, your cardiovascular system needs low sodium, high potassium balance, anti-inflammatory compounds, soluble fiber, mild, digestible textures, high antioxidant density, stabilizing effects on blood sugar and pressure. Here's what that looks like in real food form. 1. Steamed broccoli. Why it works. Rich in sulforaphane, a compound shown to reduce arterial plaque buildup. Contains vitamin C and fiber to improve blood vessel elasticity. Easy to digest when lightly steamed. Tip: add a squeeze of lemon and a pinch of garlic powder, not salt, for flavor. 2. Roasted carrots. Why it works. Packed with beta-carotene, which supports vision, skin, and vascular integrity. Naturally sweet, satisfying cravings without spiking blood sugar. Roasting enhances flavor and makes them easy on aging digestion. Tip: toss with olive oil and thyme before baking for 30 minutes at 375 degrees. 3. Sautéed kale, in moderation. Why it works. High in lutein and vitamin K, supports arterial wall strength. Cooking reduces its impact on blood thinners, unlike raw spinach. Provides calcium and magnesium for heart rhythm stability. Tip: use small portions, 1.2 cup cooked, consistent intake, and always notify your doctor if on blood thinners. 4. Baked sweet potatoes. Why it works. Rich in potassium, helps lower blood pressure by balancing sodium. Contains slow-digesting carbs, reducing insulin spikes. Supports energy without stressing the heart. Tip: enjoy baked with cinnamon and olive oil. Skip the marshmallows. 5. Cooked tomatoes. Why it works. High in lycopene, a powerful antioxidant proven to reduce LDL cholesterol and oxidative stress in blood vessels. Cooking enhances lycopene availability. Low in calories and gentle on the digestive system. Tip: use tomato paste or homemade sauces over processed varieties with added salt. 6. Legumes, lentils, chickpeas, green beans. Why they work. High in soluble fiber, which binds cholesterol in the digestive tract. Rich in magnesium and folate, both critical for heart rhythm and blood pressure regulation. Help maintain blood sugar stability. Tip: try a hearty lentil soup or mash chickpeas with olive oil and herbs for a spread. Bonus: warm herbal broths with vegetables. Why they work. Hydrating and warming, help circulation and digestion. Gentle on elderly stomachs. Encourage consistent intake of vegetables in a digestible form. Make your own. Simmer carrots, celery, onions, kale, and garlic in water. Add turmeric and black pepper for anti-inflammatory benefits. How to build a heart-loving plate. Visual guide. Here's a simple structure for seniors. Food group % of plate examples. Vegetables, cooked. 50%. Steamed broccoli, carrots, healthy starch. 25%. Sweet potatoes, lentils. Lean protein, 15%. Baked salmon, tofu, chicken. Healthy fat, 10% olive oil, avocado, flaxseed. Golden rule. Always prioritize cooked, not raw vegetables unless approved by your doctor. 3 real-life meal examples for seniors. Breakfast. Oatmeal with ground flaxseed and blueberries. Boiled sweet potato slices. Herbal tea. No sugar. Lunch. Lentil vegetable soup. Steamed kale and carrot salad with olive oil. 1 slice of whole grain bread. Dinner: baked salmon with lemon dill, roasted broccoli and garlic, quinoa with olive oil drizzle. Avoid these hidden traps, even in healthy meals. Canned vegetables with added salt. Always rinse or choose no salt added. Store-bought sauces. Check sodium content. Limit to under 150 mg serving. Fried or overly spiced vegetable dishes causes gastric and cardiac stress. Too much raw, hard on aging digestion and immunity. Simple flavor enhancers without risk. Ingredient benefit: turmeric, anti-inflammatory, supports joints. Lemon juice lowers blood pressure, adds zest. Ginger helps with digestion and circulation. Rosemary and thyme, natural antioxidants. Cinnamon regulates blood sugar. Dennis's turnaround: one bite at a time. Remember Dennis, the former truck driver? Within just 3 months of shifting to heart-healthy vegetables, he reported more energy in the mornings, no afternoon fatigue. Blood pressure went from 152/96 to 128/78. Reduced reliance on pain meds for joint stiffness. He said, "I used to think healing came from pills. Now I know. It starts with soup." Today, Dennis still enjoys food, but with knowledge, balance, and joy. What we've learned so far: not all vegetables are created equal. Some hurt, others heal. Seniors need consistency, low sodium, and inflammation control. Cooked vegetables preserve the heart, protect digestion, and reduce risks. Building a heart-healthy plate doesn't mean giving up flavor. It means flavoring wisely. Part 7. Your heart still has time. Final lessons, life stories, and a blueprint for action. Let me take a pause here and speak to you, not just as a doctor, but as someone who has sat beside thousands of seniors in their most vulnerable moments. I've seen the fear in the eyes of someone waiting for test results. I've felt the heartbreak of telling a patient, "We caught it too late." And I've also witnessed miracles, quiet, daily victories that didn't come from expensive surgeries or miracle pills, but from ordinary people making extraordinary choices. And that's what I want for you. Because here's the truth: your heart still has time. Whether you're 60, 70, 80, or 90, whether you've been living healthy or struggling with poor choices, the heart is a muscle of resilience, not perfection. Every beat is a second chance. Real story: Margie's 83-year-old heart found a new rhythm. Margie was 83 when she walked into my clinic, hunched over, tired, and tearful. "I don't know what's wrong," she said. "I eat healthy, I walk, but I'm just getting weaker." Her daughter handed me a list of her daily diet. It was full of raw spinach, garlic supplements, chili-laced soup, raw sprouts, and 2 pickles with every lunch. All things she thought were helping her, because someone online or in the neighborhood told her so. Her blood tests showed low sodium, unstable INR, anemia, and elevated inflammation markers. We made gentle adjustments, switched raw greens for steamed kale, replaced garlic pills with roasted garlic in moderation, removed chili and replaced with ginger and turmeric, removed raw sprouts entirely, reduced sodium by cooking from scratch. 3 months later, Margie came back walking tall, color in her cheeks, and a sparkle in her eyes. She said something I'll never forget. "I thought I was dying of old age. Turns out I was just feeding my body the wrong things." The 5-part blueprint for heart renewal. After 60, I want to leave you with more than just knowledge. I want to give you a path forward. Here's the same 5-part blueprint I've given to my patients over the years. The ones who got better. The ones who now walk without canes, garden again, dance at family weddings. 1. Audit your kitchen. Replace, don't restrict. Look at what's in your fridge and pantry. Raw spinach? Replace with lightly steamed kale or chard, pickles or salty sides. Replace with lemon herb cucumbers. Hot sauce and chili flakes? Replace with garlic powder, paprika, ginger. Raw garlic habit? Switch to cooked garlic with meals. Raw sprouts? Replace with roasted chickpeas or cooked veggies. This isn't about depriving yourself. It's about changing the chemistry of what you eat so that it helps you, not harms you. 2. Cook more. Trust less. The safest food for a senior's heart is homemade. Limit restaurant food and packaged meals. Watch for hidden salt in canned soups, salad dressings, sauces. Use spices, herbs, citrus, and olive oil for flavor. You don't need a chef's skill. You need a caregiver's heart, your own. 3. Talk to your doctor about food, not just pills. Doctors are trained to prescribe medications, but many aren't trained to talk food. Ask anyway. Bring in your weekly food log. Ask if any ingredients interfere with your medications, especially if you take blood thinners, heart rhythm medications, diuretics, blood pressure meds. Even healthy food can be risky in the wrong combination. That doesn't mean you stop eating. It means you start thinking smarter. 4. Build a weekly rhythm, not a perfect day. Consistency heals. Extremes destroy. Don't go from no greens to spinach smoothies every day. Don't go from bland to spicy overnight. Don't fast and binge. Instead, eat roughly the same amount of greens weekly. Drink enough water. Sleep and wake on a pattern. Move every day, even just 10 minutes. Your body doesn't need excitement. It needs peace. Peace in food. Peace in rhythm. Peace in choices. 5. Replace guilt with curiosity. So many seniors carry shame. I should have eaten better. I messed up my body. I didn't know. Please hear me. There's no shame in not knowing, but there is power in learning and in doing better. Every day your heart keeps beating is a chance to listen, to adjust, to try again. Be curious. Explore new recipes. Learn how your meds work. Ask questions. Read labels. Watch your own patterns like a detective. Curiosity is not childish. It's a lifeline. Let's recap the 5 vegetables and the lessons they brought vegetable risk for seniors. Safer alternative raw, spinach. Interferes with blood thinners. Cooked kale, in moderation, pickled cucumbers. Excess sodium. Spikes blood pressure. Fresh cucumbers with vinegar. Red chili peppers stimulates heart rate, increases inflammation. Ginger, turmeric, lemon zest. Raw garlic intensifies blood thinning, lowers blood pressure. Cooked garlic, used sparingly. Raw sprouts carry bacteria that can infect heart-liver steamed sprouts or skip entirely. Your heart is a survivor. Let it thrive. Do you know how many times your heart has beaten since you were born? Over 2.5 billion times. It never asked for rest, never asked for thanks. It just showed up, every single day. And now, it's your turn to show up for it. Feed it foods that soothe. Make decisions that protect. Live rhythms that honor its effort. Because this isn't just about avoiding disease, it's about feeling lighter in your body, clearer in your mind, more connected in your relationships, and more hopeful in your years to come. You're not too old. You're not too late. You're just one good decision away from a new chapter. What you can do right now. Here are 5 small actions to take this week. Steam a vegetable instead of eating it raw, and notice how you feel. Check the sodium on a canned food you normally use, and swap it. Call your doctor and ask, "Are there any foods I should avoid with this medication?" Replace hot sauce with lemon juice or ground cumin in one meal. Write down what you eat for 3 days, not to judge, but to observe. And then, Share what you've learned with a friend, with a spouse, with your children or grandchildren. Because when you change, you lead by example. You pass down wisdom, not just DNA. A final word from my heart to yours. To everyone watching this, to every senior who has felt confused by conflicting health advice, to every caregiver looking for better answers, to every adult child trying to help their parents eat better, I see you, and I believe in your ability to heal, with patience, with love, with food. Your heart has carried you through heartbreak, celebration, fatigue, and joy. Now it's time you carry it, with care. Let this be the day you say, I am listening to my heart, literally, because it's been speaking to you all along. And the next beat you feel? That's not just your pulse. That's possibility. With love and healing, Dr. Margaret Evans, heart specialist and advocate for food as medicine. What's next? If you found this video valuable, leave a comment with one and tell us which food change you're starting today. If you want more senior-focused nutrition videos, subscribe and hit the bell. And always remember, you're not just surviving, you're healing, you're leading, you're living.